Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
COVID way. Yeah. Okay, John Buchanan, you can start showing. A lot of interesting goals that. This is an interesting article that hits a topic that still is a problem, and that is, for example, in the District of Columbia, we still have a segment of the population that has not been vaccinated.
Wow, my gosh.
And especially in Ward 7 and 8 in the district. And it wasn't helped by the fact that J&J had to pause, because in a lot of places they were trying to use J&J as a one-shot vaccine, because the other one is two-shot, and so it's easier to do. So, but anyway, the pause is thought to have caused a lot of people to be reluctant. On the other hand, you can see that there still is a problem of reluctance on the part of Americans to still get the vaccine. Some have been willing to do it, and some still have reservations about it. It's interesting because in our group, the issue is not reservations, but actually access. But now that there is an opportunity for most Americans to be vaccinated, there's still some who have opted not to. I think the figure now is that there's over 100 million people who have been vaccinated, and the number is going up. They say what is about 4 million being vaccinated every day, but it's still well short of the percentage that we want to have vaccinated in order to get the elusive herd immunity. So this is the subject that is causing people to wonder why so many people are reluctant to get vaccinated. We talked the last time about why the health care providers and healthcare workers are reluctant to be vaccinated. And that's still, in many ways, to me, a mystery as to why some healthcare providers still are reluctant to be vaccinated. The more people that get vaccinated, the more people who will be likely to want to get vaccinated. But there's still a segment of the population that is still unwilling to be vaccinated, and this is an aspect of it that we're still addressing. Any thoughts or ideas about this problem?
I just wonder how much it's being marketed.
Wonder what?
How much it's being marketed, having, special people from the community, churches, or celebrities pushing it. How much that could help?
That's being done.
Okay.
And it's being done more now with the churches, as you mentioned, because those are the areas that have been in the past left out. But they are recognizing the concerns that you've addressed, and more churches are being involved than ever before, and celebrities are being used across the country to motivate people to take the vaccine.
Okay.
Yes, I'm sorry.
Go ahead, Kevin.
No, I'm done.
Okay.
Dr. Callender, this is Maya. I had to say, there is a small medicine shop about 2 blocks from my house, and they're giving out shots, and nobody's, you don't need any. They say, just walk in. Nobody's coming, they said.
Yeah. Mm-hmm. Yeah. Any other thoughts about that, and what else we can do?
Yeah, I don't know if we can do anything about it, but I was reading an article about how primary care physicians are taking the ethical approach, which is just making it a patient choice, but not strongly advocating for the vaccine.
Yeah.
Opposed to how it's different when doctors are consulting with their medical colleagues. In that circumstance, the doctors more advocate for the vaccine. Like, say, for instance, there was a doctor who was pregnant, and so she was researching with her, consulting with her medical other doctors, should I get the vaccine being pregnant? And other doctors would say, yes, by all means you should. The data supports it. Get the vaccine. But the same approach isn't taken with patients. It's more of it's your choice. Here's the data, but not strongly advocating for it, which is
Yeah.
kind of unfortunate. If primary care doctors would more strongly advocate for it, I know a lot of people that would be more likely to get the vaccine.
Go back up. That's a good point, and I think making it accessible actually to those same primary care doctors might help as well. But I was pointing to the fact that something that Darryl had mentioned earlier was that they said that 60% of the Democrats had been vaccinated, but only 40% of the Republicans had been vaccinated. And that's interesting that disparity still exists, even though we have a Democratic president.
Yeah.
This graphic is very similar to the election results, isn't it?
Yeah, it is.
Yeah.
That's
Yeah.
right. It is. Yeah. Well, what are we going to do to get the Republicans to take the vaccine?
Is Trump ill, or is he on the brink of death?
Stop, Carol.
And he had his.
Carol, what you gonna do about
He
your
had
sister?
his.
Yeah.
Yeah.
They still believe in him as long as he's still breathing the breath of life.
Yeah.
So his thoughts and his feelings will
Yeah.
continue to live. It might even live after he's dead. Who knows?
I had a thought about that. Remember, originally he said it was a joke. It's not happening. It's not real. And then he said it's the Chinese virus. And then
Yeah.
he said last month he said it's good. It's a very good virus. I mean, a very good vaccine. Everybody should get it, right?
Yeah, he
But
did.
that's way too late, though.
Yeah.
The thought has been implanted.
Mm-hmm.
Well, I believe he got his before he left the White House.
Yeah.
He had made it
Oh, he did.
more
He
public.
did, yes.
Yeah, had he made it
And he went to
public,
the hospital.
maybe some of the Republicans would have decided
Yeah.
to do it.
Absolutely.
He didn't encourage it, in other words.
Right.
Well, okay. Well, it's a problem that was anticipated, and it has continued to be a problem. We hope that by July it's better, because then, if we have herd immunity, it'll open things up for everybody.
Mm-hmm.
If we don't, it will make it uncomfortable for the summer and the early fall. What do you think about this? And these states that are ending the mask mandates? That's an interesting phenomenon in which the governors come out against masks, and it's kind of surprising that people that high up in the administration come out opposing making mandatory masks.
Well, the whole thing goes back to personal freedom. When a lot of people think because the government says you have to do it, it puts a negative spin on it, right?
Yeah. Mm-hmm.
If you get to choose what you're going to do and do it that way, I think especially the Republicans are saying that's the way to go.
Yeah, but that's not the way to go.
Make the government.
It's,
And
We're talking about people's
in
health.
Russia and China.
Yeah,
In Russia and China, it was mandatory,
yeah.
you know, because those are communist
Oh,
states. You
yeah.
have to do what the government
Right.
says, or get locked up.
Right, yeah.
So that's a way to
America,
think about it.
I think America is stupid because without the government, we wouldn't have education, we wouldn't have our street lights, we wouldn't have the government officials who are helping them to say it because we're paying their salaries and etc. We have to pay taxes. There's
Yeah.
a lot of things we have to do. We have to obey the laws of the land. So this thing about freedom, we're not free to do everything we want to do.
Yeah.
They'll go to jail. I mean, how free do they, what freedoms do they want to make a choice? Yeah, there's not, if you live in America, there's certain things you have to abide by, and you receive government services on every aspect of life. So somebody, they just let it run and nobody comes up and say, this is all a lie. We don't have a choice.
And you have groups of people like the Amish who do not believe in
Yeah.
injecting things into their bodies,
Mhm.
foreign
Right.
objects into their bodies, so that there's a sector there, and that's a pretty large sector. And you
Yeah.
have some religions who
Yeah.
also don't believe in things. So there are lots of sectors out there that
Mhm.
have lots of followers.
Yeah, but they stay to themselves. They don't bother anybody else. So
Yeah,
let
but
them
but
do
some
their
of them still come out in the public.
Yeah, and let them all, whatever disease they get, they contract it and they keep it among themselves. But do they pay taxes?
Yes.
I'm sure they do.
Yeah. Well, it's interesting that there are segments, as you mentioned, but I suspect that those are not the groups that are going to be the problem. It's going to be more of those people who aren't segmented in that fashion, who are going to be the problems. Those people that Carol's talking about who do pay taxes,
Yeah.
and I think it's going to be interesting in June and July to see what percentage of our population actually is vaccinated.
I kind of think as more places open up and require that they have to have a vaccination to go,
Yeah.
that will be an incentive, big incentive, especially
Yeah.
for the young crowd
Yeah. Mhm.
get vaccinated.
I saw a news report yesterday that some Black universities are requiring students to have a COVID vaccination before they can fall.
Mhm. Good.
Yeah,
That's
yeah.
good.
Was that Leslie?
Yes, it was. Good to see her.
Yeah, yeah, it is. Yeah.
Good morning.
Yeah, welcome. Good to see you again.
Thank you.
Now, this is an interesting article that points out that out of the millions that have been vaccinated, 5,800 people have developed COVID-19 infections.
Oh.
And of those, 7% required hospitalization and 74 people, and you can see the percentages yourself,
Oh my God.
died. So that's interesting.
Yeah.
And that number turns out to be 5,800, which is a big number, but in many ways, it's a small number, but it's still 5,000 people which fits into the, actually is less than the 5% that you would have thought, because it's supposed to be 95% effective, and you thought maybe 5%, but this is so much less than 5% that it's interesting. And you can see that most of the people experiencing were female. It's an interesting observation, since most of the people who die are males, especially in the minority population.
Mhm.
But yet 65% of people experienced the breakthrough were female. And nobody knows the answer to that, but it's an interesting observation. And most of them were above 60, which is another interesting observation. What are your thoughts about it? You hear that information. What does that say to you?
It says still wear a mask.
Yeah, I agree. Yeah.
So I think at face value, those seem like big numbers, but it says that's a rate of 0.0001%. And compared to 2%, that's like a difference of like 200,000 times. You still need to gamble on the vaccine. So I think that, if you were able to move that decimal point around freely, you would understand that you still have a better chance with the vaccine than without.
Well spoken.
Yeah. But even
Well
if
spoken.
you're fully vaccinated and you have a breakthrough infection, then your rate is a direct hit.
Say again, I didn't understand your conclusion.
Like there's the rate of dying with a breakthrough infection is extremely small. But if you're the ones that dies, your rate happens to be 100%.
Yeah, that's true.
So back to what John Buchanan was saying, still take your precautions if you're fully vaccinated.
Yeah.
So I still don't think it's a good idea to go off of anecdotal evidence when making these types of decisions. I think you have to look at the entire population to ascertain what your chances are.
And I think that's why with J&J, it was clear that it was going to be just a pause, because you're talking about 6 people out of millions who had been vaccinated, which is the next article. And the numbers made it clear that it was certainly worth the risk.
Oh, I'm not saying this is any basis for being vaccine hesitant. I'm saying that it's the basis for being fully vaccinated, get the vaccine, but still take the precautions.
Yeah. So when you talk about the 6 people who had the vaccine out of millions, there's the same rate of getting that condition in the general population. So I'm not sure the correlation is even robust enough to be newsworthy.
On that same note, I guess the doctors were talking to the news media, and the news media was asking, what can we do? And the doctors were saying, you publish that these people have gotten, sick from the vaccine. We'll put it in perspective. How many people actually got the vaccine? And that's what the news is not really like publishing too much, and it is creating a scare frenzy. What if the news put it in perspective that it's a very, very, very small amount of people that are having a reaction, they wouldn't have this frenzy.
Yeah, it seems like sensationalism.
Yeah.
I think it's
commercials.
I think it's safe to say that the vaccine does not work for everybody, because as doctors know, there are medicines out there that work one way on a person and work another way on another person. One type of medicine doesn't work for everybody.
Yeah.
Right.
On the far fence side, since that 0.001%, the most people that get it are old women, and the old men don't get it. And then you gotta be over 65 old. And I didn't hear anything about race in that. But
Yeah.
No, I just said the majority were over 60. It didn't say much else.
And being over 60 probably relates definitely to their immune systems.
Yeah.
I think that when you're over 65, your immune system goes down.
And I don't know why you men didn't get it, but us women, we had to get high in something. Usually you men die before us women.
Well, I would think that the only thing you could point to is estrogen levels will deteriorate when you get older. And it could have something to do with that relationship between the vaccine and estrogen.
Well, we shall soon know. We don't know yet. So any hypothesis is yet to be proven. This just goes into the Johnson & Johnson pause that we're addressing, that with the numbers we were talking about, just as Leslie had mentioned, it's likely that the pause will be short. Anybody hear any? I thought I saw something that suggested that the pause was over, but I'm not sure that that's accurate.
Dr. Callender, this is Reverend Gaddy. I heard something and I didn't follow up on it, but maybe someone else heard that there also was some problem in the manufacturing of the J&J.
Oh, yeah.
Yeah.
But I heard that this morning on
Yeah.
news.
I have an article about that later. We'll get to that.
Right.
Okay.
And I thought that they looked at that and they had decided that that was not a problem. But I'm sure as the days go on, we'll hear more and more about that.
Okay.
The other thing, Dr. Callender, is when we earlier talked about the J&J vaccine and the blood clots, all of those 6 people were all women. Is that correct?
Yes. Yeah. And they still haven't figured out why, but yeah, that's true.
Yeah, I heard that the women had previously at least been on birth control and were smokers. May have something to do with it as well.
Well, it's such a small number, it's hard to make much out of it. Now, this is something that's surprising, but shouldn't be, I guess, that vaccines are free to all, but there's some people who, I know some places they insist that they use your insurance. And some places they actually try to get people to pay money, but it's free. And anytime you get people who want you to pay, then something's wrong, because we've already paid for it. Our taxes have already paid for it. Yeah. So, have you encountered any of those kind of obstacles?
Well, yeah.
Only with testing. So to get tested at like CVS and places like that, they've asked me for my insurance information.
Yeah.
But not the vaccine.
Unity asked me for my insurance card. They said it was a service charge.
Yeah, yeah.
Wow.
I had a number of people who had the same experience that you have.
Yeah, they ask for Medicare when they see that you're age appropriate for Medicare.
Right.
They ask for your Medicare information. They say they would charge Medicare, so I don't know whether that's in correlation with.
Yeah, that's something that
it's a government program, so.
It's a little disturbing, but yeah, that's a general observation that a number of places they do ask for your insurance information.
You know, it's really ironic that people are out there scamming.
Yeah.
You know, when they're asking for the Medicare, Medicaid numbers, you know, they have those and can abuse that information. They can get your social security number off of there. I mean, it's really a sin, big time.
You know that in this country, you know, scamming is on the increase.
And also I saw this morning in the news in Mexico and Poland, they're selling a Pfizer vaccination, and they gave it to a lot of people, but it was only like some kind of, to make you look good. That's all. It's not vaccination. And they've given that to thousands of people in Mexico and Poland, they found out.
Those fake vaccines.
Right. And they said that was Pfizer to them. Yeah.
Oh
Sad.
my goodness.
I know. Oh
That's
my
the
God.
ultimate scam, to
Horrible.
put some water in the needle and
Yeah.
pretend that it's the COVID vaccine and charge you for it.
Yeah. In Mexico.
Oh, that's awful scam.
With an F.
I also heard a scam about the cards, the
Oh,
vaccination cards, that they are copying them and
oh my God.
selling them. And
Oh my goodness.
Mm.
I'm telling you, scams are on the increase. That people are finding all kinds of ways to scam people.
Yeah.
And the people over 65 who
Yeah.
don't know the technology as well can
Right.
be scammed very easily.
Yeah.
It's interesting. It goes to the point that Leslie had made, that the 7 million people had received the vaccine, and 6 people had brain clots in women, and that's an astronomical, small number of people who
Right.
actually
That's
were
true.
involved. But and that's why it's predictable that when push comes to shove, it'll be released again.
I wondered why they even bothered to pause. When I saw those numbers, I really wondered why the medical profession decided to pause the
Yeah.
vaccine. And I think the fact that they paused it has really given people that fear. Because
Yeah.
even though they're saying those
Right.
numbers,
Right.
the medical profession themselves decided to pause it because of 6
Yeah.
people.
Yeah.
And I think that has a lot to do with why they're kind of upset about it.
So they didn't give us the race of those 6 people, but I think that we can make some conjectures about the race of those 6 people based on the fact that they paused the entire program. I think that, based on our, historical experience with vaccines and medication, that they're very sensitive to that now, and they take the appropriate precautions they take before.
Yeah.
But also, like we said earlier, sensationalism, sells commercials on TV. And also, not too many people actually have gotten that J&J.
5%.
Yeah. I was really waiting to get the J&J because
Also,
my husband just didn't want to have to go back that second time.
Right. Yeah.
But because of friends, and one of my girlfriends told me of a walk-in clinic. I told my husband, but we might as well just go on, and since we can't choose which vaccine, we might as well just go on and go. And then it was maybe a week after that all this stuff about the J&J started happening.
Yeah.
So I was glad that I followed my thoughts and went on and got vaccinated.
Which one did you get?
We got the Pfizer, and we got our second shots this past Friday. So
also with the J&J, they're trying to tie some other issues that J&J had with the talcum powder, giving women ovarian cancer.
Oh.
Always
My daughter got the J&J, and she developed a fever that night of like 102.
Oh.
And another friend of hers that went with her to the facility, I mean, same place, he got sick within the next 24 hours.
Oh my goodness.
this is the week later, no new blood clotting cases. And so it's very likely that by next week they'll start resuming the vaccine, but we'll see what happens. I think the comments about the pausing is something that they tend to do whenever there's a death in any situation, but they don't usually. But when you have 6 deaths, then that becomes something that most people would want to pause, even though the numbers are not compelling.
Dr. Callender, I got a question. Do you think the vaccine can surface pre-existing issues that people have? Or do you think that those pre-existing conditions that they have would have manifested themselves anyway?
I think the latter. Yeah, I don't think they would cause you to. They are pre-existing. They're already there. All right. That's my thought on it.
Mm-hmm.
It hasn't been studied, but that's my thought on it.
You know, here's another issue as far as the difference between the Pfizer, Moderna, and the Johnson & Johnson and AstraZeneca. Even though they both use RNA, the AstraZeneca and Johnson & Johnson use an adenovirus as a vector. So it's a virus that I think it's similar to a common cold, but they'll inject the mRNA that causes us to recognize COVID as an invader into that virus and give us that virus. So that also could be another aspect of why you get different reactions.
Yeah. Okay, but it looks like the bottom line was that most people think in the final analysis it's safe to use, but time will tell. And this is another question that is answered here, and which most of us have already answered anyway, and that yes, you should still wear a mask. And the question about what is the best mask, and the answer is probably one that fits the best, because those loose masks that don't really fit well are not as effective as those masks that fit well. What does that mean, fit well? It means that when you put it on, your nose and mouth and your chin are covered. And so that all of the air you breathe comes through the mask.
So Dr. Callender, so you're saying it's mostly people's breath, from my mouth and their nose that can spread the virus. But you told us also that the eyes can get the infection.
Good memory, that's exactly right. And that's why some people wear masks as well as goggles. Because it is well documented now that the virus can be spread through the eyes.
Does that make the shield any more helpful?
Oh, yeah.
Yes. Yeah, shield or goggles. Yes.
Yeah, masks may become the new normal. They've been wearing masks in Asia for years, particularly on their mass transportation. So, even when the pandemic is, quote, over, we may still be wearing masks.
When I lived in China, everybody wore a mask. because the air was so nasty. So it was just a way of life.
Yeah.
Do you have I wanted to follow up with a question. Do you have an opinion on cloth versus paper masks?
Oh, no, I think that when you say cloth versus paper mask, I think the real issue is whether there's a filter that eliminates the prevents the virus from getting through. So whether it's cloth or paper, I think the real issue is, do you have a filter in the mask? Now, I've noticed some of these television ads that have these cloth masks that have copper and those other things. And so far, I haven't seen any studies that have tested the efficacy of the cloth masks that have no filters, but have gold and other things in them. But in my opinion, the filter is the one that makes the mask more efficient and effective. And so if you have a cloth mask that doesn't have a filter, I would have concerns.
Yeah.
Dr. Callender, one of the articles, in fact, earlier on, several of the articles that we looked at talked about the difference. But even if it's a paper mask, it has to have like 3 layers in the mask. That makes it more effective.
That's the filters, right?
Yeah, okay.
So the cloth masks that can be washed, they would not have a filter in them, would it?
Yeah, I know, and that's why I just said those cloth masks that, and I think you need to have. I think when they did studies on cloth masks versus masks that had filters, the filtered masks were the most effective. Now, but they have new cloth masks that have substances in them that appear to be filtered, but I haven't seen any studies that tested those cloth masks that had gold and other substances in them, tested against the masks that were filtered, because the filter is the thing that makes it effective.
Dr. Callender, I have an example of one here. This is, I'm a scuba diver. We have to have these masks when we get on a boat, right? So this is a cloth mask. Okay, that's the inside. That's the outside.
And it's filtered.
And it's got a slot. It's got slots in it right here where you can put the filter. And these are the filters. Okay, so if you have something like this, you're probably pretty well protected.
Yeah.
Yeah.
Regular mask with the filter.
I like that.
Mm-hmm.
Well, I think some of the TV ads have these cloth masks that have chemicals applied to them, and I haven't seen any studies. I'd like to see studies that test those cloth masks against filtered masks.
You know, Betty, what you were saying earlier, you could take the filter out and then wash the cloth mask, and then after it dries and ready to go, you put the filter back in.
Yeah, but a lot of them, I just took mine out and looked at them after Mr. Buchanan said it had a slot.
Yeah.
These cloth masks I have that commercially made, they don't have a slot.
Right, I'm talking about the slot mask.
Yeah, so I'm just saying, just a cloth mask that you can they advocate, oh, you can wash them and put it, but you can't, there's no filter in them. So
yeah,
I'll just stick with my blue mask that, you know, everybody's wearing. I have plenty of those. So I guess I'll stick with those, or either wear my shoes.
Right.
Yeah, as well as a mask.
It's an interesting topic that's become very discussed very much, but I think we need to do more studies on the cloth masks and their efficacy now that we have so many types of cloth masks.
Because people are just making
To answer Leslie's question.
Yeah. Just to look good, some people just
Yeah,
match their clothes and
Right.
yeah. They
But
have
I
a
noticed some of those people with the cloth mask, they don't even have them over their noses
that's
sometimes.
right, right.
and,
And they
and,
have rhinestones and diamonds on those.
and because I wear glasses, it's kind of hard for me to wear them.
Yeah.
Fog up every time. I'm walking around without my glasses more than I have ever done.
What do you think about this hosting fans that's already started, the Wizards and the Washington Capitals games?
Gosh.
Well, Dr. Callender, I went to a Nationals game on the 7th of April. It was outdoors. It was very well done. There were only 5,000 fans in the stadium. It was outdoors. The rows were staggered. Every other row was used. You could only eat. You had to have your mask on the whole.
John, what about the bathroom?
That stadium.
It's a serious
You
thing.
had to eat. You had to eat at your seat, and you could bring. They would bring food to your seat. They had a scan code right in front of your seat. You could order food, and they would bring it to you. I thought it was very good. The next week they went up to 10,000 people. And that's outdoors. Last night the Wizards had I think they said 2,000 indoors at the basketball game, and they actually beat the Warriors. One of the best teams. So having stands in there, but when you saw them on TV, everybody had the mask on.
But John, when you go into the bathroom, how many people did they allow in the bathroom?
They didn't really limit that. I mean, there were so few people in there, but they had somebody in the bathroom to monitor the hand sanitizers and all that. So.
Yeah, because I think it's based on the square footage of the area that you're walking into. That if it's 100 square feet, you only allow one person in there, and so that's. So I just wonder if that was being policed.
I don't think it was.
Okay.
But there were so few people in there. Normally at a big game, there's a line going into the bathroom, right? But there was so few people. There was no line or anything. Mm-hmm.
I have a question. What percentage of attendance support the whole economic, the players and everything? What percentage of, when they have a sports game, of the ticket sales that they have to people to view? What is that percentage? I know they got advertisements and supporters, but the actual attendance of games, does anybody know?
Well, if the stadium holds 50,000 people and 10% are admitted, that's just 5,000 people.
But what does that contribute to the expense, the salaries and et cetera, overhead?
Well, I think it's hard to say because television pays so much money for a lot of their salaries are paid by the TV. But I don't know the answer to your question in terms of how 10% would wind up paying for somebody who's got a salary of $20 million a year. I don't know the answer to that question, but it's a very important question because all of those teams would probably lose money. Yeah, especially if not for the television. I think television is what saves them.
Yeah.
Yeah, they can't. You're right. They can't rely on ticket sales.
Yeah.
But at the end of the year, we'll see how many teams are in the black and how many are in red.
And you don't know whether they got the PPE money in the first go round when 45 was in office.
That's true.
Now, this is the question of the day. Will you need a booster shot? And the answer is likely yes. But
Yeah.
but in all frankness, they have not. They started to test the experimental groups in last June and July, which means that they wouldn't have the antibody test results of those people until this June and July. So the only information you might get now is whether you need one in 6 months. But the answer to the question was whether it'll be every year or not, it remains to be seen. But we'll get some ideas shortly as to whether or not the 6-month test, whether the antibody titers are high or low or in between. And that will give an answer as to whether you need a 6-month booster. And later on, we'll learn the answer as to whether you need an annual booster.
Dr. The antibody test is a blood test?
Yes. Yes, the test for neutralizing antibodies, which are the antibodies that would be destroying the virus, although sensitized cells also play a factor, not only the antibodies, but also sensitized cells that play a role in it. But I think time will answer the question about 6 months. It won't answer the question about a year for a significant amount of time.
You know,
But
Dr.
the guess is that you'll need it at least annually.
Why would we need this annually when there's been other outbreaks? And from 1919, I guess they had vaccination then, polio and all of these other things that have happened, viruses. Why this particular strain? Now I know flu always, we gotta have a shot all the time, but nothing else is.
Well, this is a flu.
This is a flu.
It's equivalent of a flu, you're right.
Oh,
And because of the way in which the virus is mutating, and that's why you need to have boosters, is because you have variants and the mutations change the nature of the virus infection.
Dr. Callender, that seems like it's going to be a nightmare. If you have to give a booster shot to everybody that already had the shot, that's going to be a nightmare. And then we're going to.
Why? You get a flu shot every year.
Yeah, because the people who resisted getting the shot in the first place, maybe they went on and got it anyway, but then they're going to resist getting the booster.
Well, but it's not gonna be any more of a nightmare than you getting your flu shot every year. And as a matter of fact, I think one of the companies is talking about combining the flu shot and the COVID shot so that you get one booster shot every year.
Oh, that'll be.
But my question really involves about the hesitancy that we're experiencing now with the vaccine. You're going to get that same hesitancy with the booster.
That's correct. We have that same hesitancy with the flu vaccine. And
yes.
And as a matter of fact, the problem is that only 50% of the population actually takes the flu vaccine. So you're right. That same hesitancy is going to be evident with the booster shot as well.
It would be a great idea if they can combine it. I know several people who've never had a flu shot.
I know.
They got that vaccine. So next year, if you tell them you got to get another vaccine, well, they don't get the flu, so I'm sure they'll skip the vaccine too. But I like the idea of having it combined. That makes it easy.
And as we have aged, they've come up now with the pneumonia shot and the shingles shot.
Mm-hmm.
So, you know.
Right.
Exactly.
For those of us who are over 60, we have to get those shots anyway. Right.
We should.
Well, you're right. We should. You're right.
Yeah, but the thing about those other shots is that you don't have to get them every year. Some of them are like every 5 years or every 10 years.
Right.
That's true. Yeah, some of them that way.
Which ones are 5 and 10?
For example, the tetanus is probably 5. Tetanus,
Now, I
TB,
mean the
probably
pneumonia
5.
and the shingles, they're yearly, aren't they?
No,
Yeah.
pneumonia. No, pneumonia's not yearly.
Oh, it's not.
No,
yearly.
And shingles is a one-shot deal. Yeah, it's 2 shots, but it lasts
Once
forever.
you get it, that's it.
That's it.
Yeah.
Okay.
How about the pneumonia injection?
Yeah.
Pneumonia.
Just one.
Pneumonia is also a 2-shot. And I'm not sure how often you need it.
I want to say 5. It's either 5 or 10. I'm not sure.
Something like that.
Yeah.
So they gave
Every
the pneumonia shot in boot camp, and then they didn't suggest it for me again until 20 years later.
Oh.
Which shot taken?
You look young chicken.
Yeah, but you were so young.
You little baby.
So the pneumonia shot was trial when I was in boot camp, and so we were part of the trial. I remember that distinctly, being part of the pneumonia shot trial.
Mhm.
Then 20 years later, they said, "Oh, you have all these diseases and conditions. You need a pneumonia shot." And I'm like, "Okay, put it here."
Dr. Callender, at one time with the shingles shot, it was a live virus. I've never had it. I didn't have it at that time because David, in a transplant patient, I couldn't have it because it was a live virus. Is there a different shingles shot now that's
Yes.
not?
Yes, it is. That's why transplant patients can now take it.
Yeah.
Because, yeah, it's a different one.
Yeah.
Because transplant patients can't take live viruses. You're absolutely right.
Right. And the shingles shot is just a one-time deal? Shingles? It's not something
Yes,
you have to get
after
every
65, yeah.
Okay.
So transplant that are
What you say,
young,
Leslie?
transplant patients that are younger than 65, should they also have a shingle shot, or do I still get to wait until I'm 65?
I think it is clear now that if you have a transplant, that you need to get a shingle shot if you can get a shingle shot that is not a live virus.
Okay.
Because the activation of the virus occurs because of the immunosuppression. Now, before they were able to get this new non-live virus shingle, transplant patients couldn't take it. And so they just had to take their chances. With this new shingles shot that is not a live virus, it is recommended that they take it because they're immunosuppressed. And that's what happens that makes the older people vulnerable, is that as they get older, the antibodies wane and disappear. And for that reason, transplant patients should get the vaccine if it's available. The problem with the new vaccine that is not a live virus is that it was hard to get because they didn't have enough supplies. And so as a consequence, many of the transplant patients did not get the new shingles virus vaccine.
Yeah, just a reminder, the people most at risk for shingles are people that have had chicken pox before, because that virus remains in your body inactive, but when it re-triggers later in adulthood, it can show up as shingles, and shingles is extremely painful.
Right, and and once you get that painful shingles, the post-herpetic syndrome that develops is often deemed intolerable by those who have to get it.
It can make you lose your mind.
Is it like?
Absolutely.
What do you make of this article? This is, you talk about scams. This is kind of scary that we would pay 1.3 billion to make vaccine syringes and there are no syringes. That kind of is kind of scary. And as they asked the people about it, nobody could come up with any answers. It's kind of frightening that we pay that much money and not get any result.
Well, it's a circle of life. The companies that get these government grants, they make campaign contributions, and the campaign go to legal defense funds.
Yeah. Yes. By year end 2020, now this is 2021. So that is awful. Well, the question is, who's gonna follow this up?
Don't they have to have money to follow it up?
Well, they need to pay that money back. That's our money.
Yeah, yeah, right.
Our taxpayers' money. But oh well. I noticed nobody said anything today about the verdict.
Yeah, because we were talking about the coronavirus.
We have to save that for a whole session. Let's say court's in session.
Since it started on March 29th, there have been 64 police killings of unarmed civilians, more than half of which are black or brown. And so the rate of police-involved killings of unarmed people has not slowed down a bit since the trial.
Oh my gosh.
There's usually 1,000 killings a year. And of those 1,000 killings, since 2005, there's only been 144 cops charged as a result of killings and only 44 convictions. And so if you're talking about microscopic percentages, cops can still kill and get away with it.
Oh my goodness. My goodness.
Well, what do you think the impact of this finding this policeman guilty will have on the future?
Did you see that
being killed?
Did you see
others being killed by police?
Did you see Eric Chauvin's face when they said that he was found guilty, and how surprised he looked?
Couldn't believe it.
Yeah,
no emotion.
I felt believe it. So I think now everybody will move forward collectively, knowing that you can be held for wrongdoing if you're a police officer. I'm hoping that that'll be.
Also, I was really shocked. Eric, that guy Chauvin, he's married to a Vietnamese girl for more than 12 years.
She left him right away.
Immediately. No, they got a little scheme going on.
Immediately she left him.
They got a plan going on.
And he had 2 sons that was Vietnamese Chinese in their 20s, 26 years old, She was married before. I said, oh my God, I couldn't believe it. I just found that out yesterday.
Oh, sure. But he believed he's above the law anyway. So I told y'all we got to have a day in court with this. We got to do our homework.
Yeah. I agree with you. I agree.
I don't know how he's going to last 8 weeks to be sentenced. I mean, solitary confinement. He can't do anything by himself. He has to be protected.
That's standard.
He is. Trust me.
Do they plan to appeal?
Yes.
The verdict?
Mm-hmm.
All 3 of the verdicts?
If you understand human dynamics, you beat one kid for doing something. Do you think the rest of the children are going to stop? If you put somebody in jail for killing somebody, that's why they had the death penalty in order to curtail it. They had the war on drugs to curtail drugs. So if you put so many in jail, the rest of them want to stop smoking the weed. It never does work in human society. They can have all these stringent rules and laws, but it's always someone who think that they can get away with it. They were too stupid for getting caught. Even ourselves, I'll run a yellow light for fear that they don't have the camera there. Even though I know there's a penalty and I might get a $200 ticket for running that yellow light, but there's always that chance in humans that I can maybe beat this, especially if that light is not there. Just because they prosecuted him and put him in jail does not scare the rest of these policemen that are not going to do anything.
Right.
Amen.
And the same day, the police officer killed a 16-year-old child, a girl in Ohio.
Do we know any of the circumstances?
Well, they're still trying to. That's my hometown. Oh yeah. So, but she was getting ready to stab the girl. So we're talking about again a lot of different factors.
With your medical student, you emailed me back telling me to call you.
Yeah, I'm in a meeting now, so let's try again. Okay.
Okay. All right. Thank you.
Okay.
But they said she was trying to protect herself, so why didn't the police again tase her?
Because a taser does not always stop someone. If somebody's getting ready to kill you, somebody's getting ready to stab you, he was torn between two things. Am I going to protect this girl from getting killed or whatever? It's an act of emotions so quickly and a judgment call sometimes. I have to stand sometimes on the side of the police officers also. And I guess I'm a little partial because my son is a police officer. But anyway.
Get off of the killing of that girl because police, they say reasonable force is when the police has fear of their own life or somebody else's life is in jeopardy. And so the girl that was killed had a knife that they said she was trying to kill another girl. So they're going to get off for that. But 2 days, got a new name, Andrew Brown, North Carolina. Police killed him. He's unarmed. He was trying to flee arrest, drive away when they were trying to serve a warrant. But, that's no reason to kill somebody that's unarmed just because they're driving away. There was a white man that was driving away last week and no incident whatsoever. Didn't shoot up his car. But it's North Carolina, so don't expect any charges to be brought for Andrew Brown.
Absolutely. But can I just say one more thing too? I say just need a court date, but we also have the other side of these issues too that we're dealing with, and no one wants to talk about it. Everybody wants to be hush hush. Look at the two women, and I don't know the details of that, where the lady was pregnant and they were shooting or cutting or doing whatever they did, and the baby is alive.
Yeah. What was that story?
See, a lot of things we're doing, a lot of stuff to ourselves as well. And I can surely say this. I have a teenage son in this house, and if I fear him, I would want to call the police to come and protect me, but I wouldn't want them to come and kill him. So again, it's decisions that we make when something is gone crazy and go, wow, if I can't handle him, and I think the police have to come in and handle him, and I already know he's halfway crazy. He may be on drugs, he may have a gun in his room. It's just a lot of issues that we're not really addressing. It's not just cut and dry. But anyway, that's just me this morning.
I agree with you that it requires another session.
Also, young people do not know how to deal with conflict resolution. They don't know how to talk things out. I mean, back in the day, you used to have fist fights and then you still be friends the next day. Everything they do now is final. You can't go back and say, okay, man, we cool.
But
it's just too final.
Sometimes I wonder too, why when the police is confronted with these types of issues, it's always kill. I mean,
Yeah.
you can shoot somewhere else.
Right.
At least
You
stun the
have to
person,
stop them though. You
to
have to.
give them a time to make another move or something.
Well,
Right.
yeah,
I
well,
just,
I
I hear the police say that, you know, it's a split decision, but you can have a split decision to shoot in the leg or shoot in the
Right.
arm.
but that won't. That may not stop
Okay.
them.
That would at least stop them for
It
Well,
may
an incident
not
or two.
stop them though. It
I
may
think
not.
that this discussion can go on forever.
Yeah,
So
it can.
why don't we go back to
4
to,
hours.
uh,
Where
Four
why
hour.
we-
the
yeah.
A
subject,
4 hour. A
because
4 hour meeting.
because I think you're right that this is a subject that you could have a
Yeah.
whole day discussion on.
Mhm.
I think that the article that John was putting up just talks about the comment that was made earlier about Johnson & Johnson having a plant that was suboptimal. And that was and is the case. However, the inspection I didn't find that it related to the vaccine itself. And I think actually Darryl had made a comment maybe about a couple of months ago about the fact that a lot of these places were not being investigated because they were making the vaccine and therefore they were getting away with practices that were suboptimal. And this just confirms that although they will tell you that it had nothing to do with the making of the vaccine.
Dr. Callender, something underlying. Why are they really investigating Johnson & Johnson?
Why what?
Why are they so scrutinizing Johnson & Johnson so much?
Well, I think after the allegations about the clots, I think they decided to go in and do it. I don't know any other reason.
Maybe another reason is because Johnson & Johnson is a one-shot deal, where the other viruses are two-shot deals. So they want to find out what Johnson & Johnson did that made them a one-shot deal.
Well, that's one hypothesis.
AstraZeneca also has been investigated. There were some deaths.
Okay, is this the last article, John?
Well, yeah. There's a meeting today. Let's see if I can turn this off.
One thing,
AARP
has so much good information.
Duh. Mm-hmm.
So I put it in the chat. So if you click on that link or copy that link from the chat, you can get to this.
Turn one of your volumes down, John. You got an echo.
I'm trying to figure that out. Let's see.
Is everybody on this talk been vaccinated?
Yeah.
Yes.
Everybody has been. Oh, that's wonderful. Good.
Yeah, I got both of mine.
Good. Okay.
Dr. Callender, I have a question. Are there any statistics on the survival rate of people who come down with the virus?
There are many statistics now. Which one are you interested in getting?
The percentage of people. See, I have a cousin in Indianapolis who had the coronavirus real bad. You know, in other words, the kidney shut down and a whole bunch of other things. He had it very bad. So I was wondering, what is the survival? He survived. So what is the survival rate of people who have COVID?
Well, okay. When you look at, for example, about 10% of the people who actually get the infection actually are hospitalized or die from the infection.
Yep, thank you.
Something like 10%.
Okay.
So that kind of is, the mortality rate is somewhere between 5 and 10%.
Mm-hmm.
I have an update. He's referring to our cousin Rodney Stepp in Indianapolis. and kidneys shut down. He was on dialysis for about 8 months. He's just, as of last week, he's been taken off of dialysis. He spent
Wonderful.
35 days as a trial to see if he could maintain his status. And so now the doctors have officially taken him off dialysis. He's keeping the home dialysis equipment for 2 months just in case. And he's also on the transplant list just in case, but it looks like his kidneys are recovering. Oh, praise God.
That's good news. That's good news.
Yeah.
That's good news.
Very good.
But did that answer your question, John?
Yeah, it does. 5 to 10% people survive having the coronavirus.
Oh, no. I didn't say. I said
mortality.
I said they die. I said 5 to 10% die from coronavirus.
Okay.
Because most of the people who get the infection may not even know they have it. They were asymptomatic. And just like the guy who's going to sing at your dad's funeral, who was positive, he may have been totally asymptomatic. And they say that 30% of the spreaders of the disease are asymptomatic. So they have the virus and don't even know they have it. And then you have another group that are symptomatic, but they don't get sick enough to go to the hospital or require any medications. So it's only 5 to 10%, but that 5 to 10% is for which is lethal, associated with hospitalization or death. And so that's the group that you don't know where you're going to fall into it. Certainly if you're over 60, then the mortality rate is higher because that 5 to 10% is of all people that are affected by the virus. And whereas for the mortality rate for those people who are people of color and are over 60, then that mortality rate is higher.
Yeah, well, Rodney's double blessed because he's over 65.
Praise God.
Yeah.
Dr. Callender, I just have one question to ask you. Something they said about 3-4 weeks ago that they had all the vaccinations for dialysis patients in the country. Can you tell us if the patients have been vaccinated, dialysis patients in the country?
I don't know because I don't know the answer to that question. You're asking how many dialysis patients in the United States have been vaccinated? Is that the question?
Right. They said something that the government has given for all the dialysis patients, all the vaccinations to give it to them.
Yeah, I think the figure I read was about 60%, but I don't know if that's correct because in my estimation, they started doing dialysis patients late. And so I don't think they are even close to reaching all of the dialysis patients in the United States. But they have started doing that, but I don't think they've done that. What about in your unit, Pearline? Is everybody there been vaccinated?
Yeah, everybody.
Oh,
Yes.
Good. Wonderful.
Everybody has been vaccinated.
Wonderful.
Capital, yes.
They're certainly eligible, aren't they, Dr. Callender, because of their kidney failure? And they should be in the front of the list.
Yeah. They weren't because they had not, in other words, of the people who were tested and who had the vaccine, dialysis and transplant patients were not in the group. And therefore, they were reluctant to start doing them until after everybody else had been done. So that's why they weren't first, because the vaccination studies were done on people who were not dialysis and transplant patients. Okay, so
I had a question, Doc.
Yeah.
2 statements. Did I share with the group about my swimming last week? Did I tell you guys about that?
No.
No.
Okay, so several months ago, they opened up the 5 indoor pools in DC for swimming. You have to register online. You get an account. You go to the calendar. You click the date and the time you want to go. They'll send you an email confirmation. You can only swim for 45 minutes, okay? Which is better than nothing. But
right.
So they only have 8 lanes in the pool that are open, and you wear your swimsuit to the pool. You change at your chair right at poolside, and then you swim. You get out, you dry off, you put your clothes back on, and walk out the door. So it's a little strange, but I went 3 times. I went Monday, Tuesday, and Wednesday last week. It was wonderful. I hadn't been swimming in over a year. Okay. So that's in DC, and I think several pools in Montgomery and PG are also open that for swimming.
No shower, no shower.
No showers. That's right. You can use the bathroom, but you can't take a shower. You have to go home and take a shower. The other question I had for the group, I want to put this out there. The manager of my band sent an email yesterday wondering if we are ready to go back to play indoors. So we have several performances outdoors, which I've signed up for, but he wants to know if we are ready to play indoors, and he would follow all the guidelines, you know, for performance indoors, the number of people and all that. You know, people be masked and all that. But what do y'all think about that? Going to a club, you know, or indoor venue for dancing. What do y'all think about that?
I think that that's something that is not only being done for your group, but all of the entertainers. I saw that many of the concerts are being rescheduled, but most of them are being rescheduled for the fall.
Yeah.
Oh.
What are some other thoughts?
John, first of all, your wife allow you?
Yeah.
Girl, you
So far,
united.
So far, so good. Yes. So far, so good.
That's the question.
We go back to rehearse week after next. So rehearsal's good. Outdoor performances are good. I haven't asked her about this indoor thing.
Don't ask, don't tell.
No, be careful. You don't want to be kicked out of the house again. So
yeah.
Well, John,
I'm
faced with the same question because I'm getting calls to start performing again in indoor clubs, and I'm scared. You know, at some point, I guess I'll have to bite the bullet. But on another point, being a swimmer, aren't you concerned about chlorine erosion of your teeth enamel?
Let's see. I've never thought about that.
Yeah.
You could ask John Tatum Sr. about that.
The internet recommends for swimmers to get an extra dental cleaning through the year.
Yeah.
The chlorine buildup is what they call swimmer's calculus on the teeth, and extra cleaning could help avoid that.
Right.
My father had false teeth, so he didn't have that problem.
Take them out.
I got a question. Because you're blowing the horn, right, John?
Correct. And the keyboard.
Do you put anything over the bell part to catch, the
duties?
Because we had a lot of videos on that. The wind instruments, string instruments, okay. Keyboard, okay. Vocalists had to stay about 9 to 10 feet apart because of ejection. Now, what about wind instruments? And you're playing a wind instruments. And I've seen several bands. I saw that at Reed Temple. They had their orchestra out and they were playing and nothing covering the wind instruments.
Oh,
it's hard. So Talk to me about that.
Well, I have a cover for the bell of my horn. It makes the sound different though. But I'm not going to go back with my group unless everybody's vaccinated. So I don't think I'll have that issue on stage. But I'm worried about the clientele, whether, after they get 1 or 2 drinks, whether they're going to keep their mask on.
Not when they drinking.
Right.
No.
After
they drunk,
1 or 2 drinks.
are they going to take off their mask?
No, they're not gonna keep it on either way.
Right.
Well, with Carol, with the French horn, I don't have to worry about it because on the French horn, the bell is going backwards behind me.
That's why they infect everybody that's behind you.
Ain't nobody behind me.
Everybody that's been fully vaccinated, but when the clientele starts to drink, yes, the masks come off and they don't go back on once they finish their sip. And the other thing is they approach the bandstand and want to get up all in your face. So then it's up to the band to back them off. That's not very customer friendly, but that's just some of the dynamics of working at a club. It's dangerous because of the clientele. Clientele is crazy and they all up in your face.
Yeah.
It would be the concern that.
I'm past my club days, so you asked.
So how about in the parks though? How about when we have the little park gatherings? How can you say can that be a little bit safe?
Yes, very, very much so, because you got it's just like wearing a mask when you're walking outside, Okay. It's a lot safer.
What about having screens that separate the band from the audience?
Yeah, that's called chicken wire. You saw that in the Blues Brother movie.
The virus gets through the chicken wire.
Well, but they now have big screens that are transparent and are protective.
Yeah, well, they're using plexiglass now.
Yes.
Plexiglass.
They've always been using it for the drummer. They put a plexiglass barrier around a drummer, but now those plexiglass barriers, they can be used for anything. When you go to the store and behind the counter, they have them,
Yeah, you can do that for the separate the band from the clientele.
Yeah.
But the plexiglass for the drummer, especially in churches, that's because they're not skilled. They don't know how to play softly. And so in order to control the sound and not blast everybody out, they put them even in cages and then they mic the cage. So it's really ridiculous because they don't have trained musicians who are playing the drums.
I've seen those barriers with a lid on them too.
Yeah, they put a lid everything. If you go to your church and you see a lid and everything around those drums, the church is trying to compensate and they don't like those electronic drums. But that's good.